Dr. Yates. Just wanted to talk a lot about what we hear all the time. Does size matter? Do you guys know what I'm talking about? I'm talking about punch size, okay? So I have my trusty assistant, Blanca, who knows all about does size matter. You know does size matter, right?
It does.
Okay. And Blanca said, yes, it matters, okay? And we're going to explain how it matters as used with punches, because a lot of people come in and they know the right questions to ask. They'll ask like, well, what size punch do you use? And people will say, do you use a size 0.6 millimeter? So this is what we're talking about. People come in and ask me, do I use the size 6 millimeter, a 0.6 millimeter punch? Okay, that's smaller than 1 millimeter. That's tiny, okay? So punch size, usually the smallest I've seen is like a 0.6 millimeters up to about a 1.5 millimeter punch, okay? So this is usually going to be the range. And the key with the punch size is it's like a game. It's like playing golf. You want to get the hair out with the smallest punch you can use, but what? But that doesn't injure the hair, okay? Because somebody all day, they could use a 0.6 punch and tear your hair up, and you will not be any wiser, and your result won't be good. You can go around and say my surgeon used a size 0.6 millimeter punch, but that didn't do you any good because it tore up your hair. And let me just explain one thing. When we go and we punch hair, say we punch hair from your donor, this is X. When we punch the hair out, if we don't get it out right, say we destroy it, and then we plant it, here's the top of your head over here, when that hair is planted and it doesn't grow, when you leave the office, you leave the office with less hair than you had when you came in. A lot of people don't understand this. So say here's your back. It's full of hair. If I punch it and I say, I'm the 0.6 millimeter man, and I just punch, but it's not accurate, so we have a dish of pretty much shredded hair, okay? Like shredded wheat, or is that a cereal? Shredded? Something shredded? Yeah, shredded whatever, shredded hair. I'm answering your question. I'm using a 0.6 millimeter punch all day, making these holes small, but I'm tearing up your hair. The hair that we punch back here does not grow back. Somehow, mystically, a lot of people think hair, when you punch it, it grows back. It's gone. So you have to think, we're taking out hair here to move here. We're robbing here to make this better. And the whole trick of a hair transplant is to make it so magic happens here and magic happens here. But if you destroy back here, you're going to leave the office with less hair than you did when you came in. So this is what I want to explain. So here, say this is the punch and this is the hair. It's all dependent on the operator. It's like playing golf. If I hit my driver and I hit it 350 yards off the tee and I use a whatever, and then Blanca were to ask me, well, what did you hit, Bill? And then I tell her I hit a zing-zong driver, but she's never hit a zing-zong. Then she hits a zing-zong driver and hits it in the woods. It didn't do her any good, She should just use what she's used to. So the trick is, it's not what punch size you use, it's the smallest punch size that allows you, here's the hair, to go around the hair, core the hair out, because this is what my job is. This is the hair. I go boom, without injuring it, and then Blanca, you would follow up and use the instrument and pull that hair from the scalp. So every time when we do someone's hair, the first thing Blanca and I will go through, it's like a pilot in a cockpit. We'll look at the hair, we'll look at the diameter, and we'll decide what's the smallest punch we can use that will not injure the hair. And you can't have like a lot of ego about this. If you have to get up to a 1.2 punch to get the hair out right, if you're good at this, you accept it because you know it's not you, it's just whatever you have to do. And I can guarantee if you use a 1.2 punch and you use it well, the back of the hair is still going to look good. So what I'm saying to patients is, it's not the size of the punch that counts, it's how well do you use that size punch. So you can ask, these are the questions that people ask us all day, right, Blanc? They'll say, what size punch is that? Like they know the difference, So if we say it's a size whatever, they'll say, oh, well, Dr. So-and-so uses or whatever. But then I'll say, well, that's great, but you're not in Dr. So-and-so's office, so why are we talking about that? Because what we're trying to do, and I always tell patients, selfishly, I'm trying to make your hair as best as I can make it, for me and for you. so we can brag. So I think it's perfectly acceptable anywhere in between that 6 to 1.5 to do whatever's necessary to get the job done. Just to say you use one type of punch, if somebody said they used a 0.6 punch on every case, even an African American or what we call Afrocentric patient, then I would want them to show me. Simple as that. And we call that, what do we call that? The shoe test, right, Swanka?
Yes.
Like, and I'll show you, like over here, say, this is how we usually do it. The patient's sitting in a chair like this and the head is down like this. So when I come down, I tell them always look at the shoes of who's doing the punching, because even if you're on a lot of medication, you know, my shoe looks a lot different than if Blanco's shoe comes in, because a lot of tricks happen with hair transplants. A lot of people say it's just semantics. Oh, I do FUE, I use a size this punch, but when it's time to punch, somehow miraculously the shoes change, and then they'll see somebody else's shoes down there, you know. So you want to make sure, especially that person that's so adept at a 0.6 punch, has the same shoes, okay? And maybe everybody will get smarter and start wearing big shoes. You could start wearing size 14 shoes and you could start punching. But so, and the other thing that you must consider that no one considers, you have to determine each punch, how many grafts per punch do you get? Because say if you're using a 0.6 millimeter punch and the density of each graft you get is just one hair, and say somebody else is using a 0.9 millimeter hair, and the average density of each graft they're punching is 2.3 hairs, you can see, just quick math, every time the 0.6 guy punches, the guy with a 0.9 is getting twice as much hair for you with the same amount of grafts. So you're going to have a better result. So there's so many inherent little things in here that seem kind of obvious, but they're not obvious. All I'm saying is by asking somebody how much punch, what size punch you use, that doesn't help you, you know, if you don't know the other questions to ask. And the other questions would be, well, are the grafts destroyed? That's called the transection rate. But what will the answer be? The answer will be absolutely not. And then what are you going to say? Let's go. Okay? There's no way to check that other than seeing the patient or saying, can I see you do a case, and watch them on their own punch the grafts, and then you look at the dish and you see, say out of 10 grafts, how many are destroyed. That's the only way I can think to do it. And anybody who comes to our office is always welcome to see us do any punching, to see any other patients, to see what their hair looks like. Because when you see different patients on the internet, this guy did 2,000 grafts, this did 1,500, I'm going to tell you it's meaningless, because everybody's head is shaped different, the hair is shaped differently, the texture of the hair is different, so you really can't compare. And the best thing I always say is I have friends that, you know, everybody has friends that are like horrendous looking, you know, we all do, right? And some of our horrendous looking friends take the best selfies, right?
Yes.
I mean, like Kim Kardashian selfies. So if our horrendous looking friends can take beautiful selfies, what do you think is going to happen to somebody in an office with their hair to make all these post-op pictures look good? You think bad pictures are going to show up? Absolutely not. It makes no sense. So the internet is not the Bible, you know. So everybody comes in saying this person said it's not the Bible, unless you know that person. And I mean like taking a shower with that person so you can see their hair and they get out of the shower. What somebody tells me about somebody else's hair, I listen, but it doesn't really weigh in on me, because now more than any time in medicine, especially this branch of medicine where there's no double-blind studies, it's full of trickery. So I just want to make sure that patients understand what all this punch size means. It's not how fast you run, it's what? How well do you run fast? That's what it is. Not how fast you run, it's how well do you run fast. And the other thing that always comes up that when we do retail medicine that has to be respected first and foremost in anybody's office, when people come in and they say, I'm paying you X amount of dollars, so I want this. Meaning, like usually with hairlines, and we do a lot of videos on hairline design. You know, just because somebody is paying somebody, you know, doesn't mean that they're allowed to tell you what to do. Like, and this usually comes up with hairline design. Like, and you see it all the time in the room, Block. Guys will say, well, I used to have a hairline like this, okay? That's that, okay, like this. And that's fine and good, but as the human body evolves from being 15 years old, a lot of changes happen that are natural even with the hairline. The hairline goes back. It has more recession even if you don't lose your hair. So for me to fix you in time when you're 15 years old, even if you paid me $8 million, it's not going to happen. So what people are paying for when they come in to get surgery, they're paying for basically my expertise to do the best job we can to make the outcome with the hair the best we can do. That's what they're paying for. They're not paying for me to just oblige their wishes, you know, because we spent way too much time studying hair for that to be the case. So I put that out there with our hairline design, and I hope people see this, because if anybody says that they are paying me a lot of money to do something and I walk out of the room, I want you to understand why. Because I don't negotiate. Those aren't negotiations. You're paying me for my skill to make you look the best you can look. If we disagree and I walk out of the room because of things which you don't understand what a medical degree means, you know, I don't know what to say, because there's a lot that goes into this more than you paying any amount of money. There's no amount of money you can pay me to make me do anything. Or you too, right, Vaughn?
Right.
We got principles and morals,
Yes.
and what else we got? We get
Principles,
lots of
more
we got
principles.
more principles and more morals.
Yes.
And the other thing is, we know what works. And that's the thing that is so surprising when people come in and doubt your expertise and want to show you a picture when they're in high school with the baby blue suit on and their hairline, and they're now 35 or 40. You know, please, what difference does that make? You know? So, enough of that. But don't come in our office. You know, we're just setting guidelines here, and tell us how much you pay and what you want, because we don't speak that language here. We speak quality here. We speak experience. Everything that we've done, we do on you. We do it on ourselves. People in the office have had the same experience, and we've seen the good, the bad, and ugly of this whole process, and we only want the best for you. Anything else, Blanky?
We also have good reputation, so.
Yeah, we have good
we wanna keep
reputation.
that.
We want to keep that.
If we do bad hair, it's bad reputation.
Yeah, and everything's expectations. So we never want to lose sight of that, you know. That's what we have to say today. Size does matter. Smallest that you can do well is what you want to do. But don't be afraid, and this is for doctors now, don't be afraid if you can't get the graft out with a 0.9 millimeter punch to move up to a 1 and get it done right. The results will be fantastic. Everybody will be happy, instead of holding on to that 6 millimeter punch, 0.6. You know, the parallel, and only surgeons are going to know this. When I was doing laparoscopic surgery, you're doing a laparoscopic case and it's not going well, and you know you should convert to open and make that big incision. But you don't do it because your pride keeps you from doing it, because you want to say you're purely laparoscopic, and you only open the patient up when all hell breaks loose. And by then it's, you know, it's not so cool. So you have to get over that as a doctor and do what's right and make those decisions very quickly. Don't waste a lot of time, because every hair that you injure, the patient has less hair than when they came in. People understand that. When the day is over, even in a good doctor's office, they're leaving with less hair than they came in with, because there is going to be a negligible transection rate or injury rate. So even in the best hands, which we think are here, and there are plenty great doctors in the United States, even in those people's hands, you're leaving with less hair than you came in with. That's weird, huh? But that's how it goes. It's Dr. Yates in Chicago. Thank you.